Great question. Why can't you do liposuction during a tummy tuck? Or can you? So I will tell you this is somewhat surgeon specific. Um, yes, you can do some limited liposuction during a tummy tuck, especially if we're not doing liposuction on the tummy tuck flap itself. So you can definitely do liposuction of your back, your waist flanks, your legs, arms, etc. That doesn't interfere at all. What we worry about is that the blood supply that feeds the flap or keeps it alive goes through the fat cells. And so when we put a cannula into the fat cells to try to remove them for liposuction, we're actually coming usually from the top, and that is really where the blood supply lives. So if this is your skin right here, then you have two layers of fat cells. That upper layer, that's where all of the blood supply lives to supply the tummy tuck flap. The lower layer of fat cells, or the deeper layer, is what we're really trying to take out when we do liposuction. So typically when I do a tummy tuck, I actually just cut those out as I can see them when I'm doing the procedure. But I worry that if we do aggressive liposuction at the same time as a tummy tuck, that we can hit some of those really important blood vessels. And so what can happen if we harm the blood supply to a tummy tuck flap? The answer to that is actually you could have wound healing complications. The wound can actually break down. It can lead to increased risk of infection because it's not getting as good of a blood supply. So in my practice, if patients want an even more refined or contoured appearance, I will often recommend that we stage their liposuction for another time. So this doesn't burn that bridge. You can certainly have a tummy tuck and then do more etching later if you want. But I'm of the opinion that I want to decrease the number of risks to my patients, and I want that incision from the tummy tuck to heal as best as possible. And so for that reason, I don't recommend really aggressive liposuction at the same time as a tummy tuck. And I hope that answers the question.